Should autistic children be tested for heavy metals? Have you ever wondered about the connection between heavy metals and autism? This is a question many parents and caregivers ask when considering the health of autistic children. Understanding this relationship can help us make informed decisions about testing for heavy metals. Heavy metals like mercury, lead, and arsenic are known to be harmful. They can negatively affect health, especially brain development and function. Research indicates that children with autism spectrum disorder may have higher levels of these toxic metals compared to their peers. This exposure can worsen autism symptoms or even play a role in its development. Heavy metals can disrupt brain function by causing oxidative stress. This happens when there is an imbalance between harmful substances and the body's ability to neutralize them. The result can be cellular damage and inflammation, which can impact overall health. So, how do we test for heavy metals? Testing typically involves analyzing samples from blood, urine, hair, or nails. Each of these tests can provide insights into both recent and past exposure. For instance, blood and urine tests show current exposure levels, while hair and nail samples can reveal historical data. Interestingly, baby teeth enamel is particularly useful for assessing exposure during pregnancy and early childhood. Testing autistic children for heavy metals can be helpful in several ways. First, it can identify significant exposure to toxic metals. This information may help explain the severity of autism symptoms. Second, if testing reveals high levels of heavy metals, it can guide treatment options. Detoxification methods may be considered, but these should always be approached with caution and under medical supervision. Lastly, knowing exposure levels can help parents take preventive measures. This might include avoiding contaminated environments or choosing safer household products. Now, let's consider the link between autism and gastrointestinal issues. Many individuals with autism experience gastrointestinal problems, and some studies suggest these issues could be connected to heavy metal exposure. By identifying and managing heavy metal exposure, it may be possible to alleviate some gastrointestinal symptoms. In summary, testing autistic children for heavy metals can provide important information about environmental factors that may be affecting their health. However, any actions based on these tests should be carefully considered and guided by healthcare professionals. While some treatments claim to detoxify heavy metals, they are not universally accepted as effective or safe. Always consult with a healthcare provider before making decisions based on testing results.